Welcome everyone to Digital Futures for Good and the episode on healthcare and digital inclusion. I'm Helen Milner. I'm the Group Chief Executive at Good Things Foundation. And I'm really delighted to have two guests for our expert panel today. And we'll be showing some clips from the Digital Futures for Good um, filming episode that I did with Dr. Minal Bakhai, who is a GP and also the policy lead at NHS England for primary and social care transformation, and Professor Sam Shah, who's a digital health advisor, a clinician, a lawyer. He's working at the Ivory Clinic and he's working all over the world. So it's great to have had that conversation with Minal and Sam. It's probably worth saying that we had the conversation before the election and even before the election was called, of just the way the filming and the episodes come out. So, if they say anything a little bit odd, and if it looks like they don't really know that we've got a new government, then give them some slack. It was filmed before the election because it was a bit of a surprise, the election. Digital Futures for Good is our 2024 conversation series where we're talking to thought leaders about a range of intersecting policy areas with digital inclusion and everything that we do from with the conversations we have with our experts and our thought leaders and our expert commentator panelists and the comments that you put in the chat panel and the questions that you ask will all go into the hopper for our summary report that we'll be publishing towards the end of 2024. So let's kick off. Welcome to Katie Dowson and to Dr. Emma Stone. So Katie and Emma, I'm going to ask you to introduce yourself. So over to you first, Katie.
Thank you. So my name's Katie Dowson. I'm Director of Digital Transformation for NHS South Yorkshire Integrated Care Board. I'm responsible for a number of portfolios, but digital primary care and digital inclusion are included in those. Now, in South Yorkshire, we have a population of 1.4 million people, and 37% of our population are living in the 20% most deprived communities. So it's really important that we have proactive digital inclusion support on offer.
That's fantastic. I'm sure you'll tell us more about it as we go along today. And Emma, introduce yourself.
Yeah, hi everyone. I'm Emma Stone. So I work for Good Things Foundation. I'm Director of Evidence and Engagement there. I joined 6 years ago and thinking about digital inclusion and how it relates to health access, health inequalities has been a steady stream and one that's of growing importance. Obviously, it was hugely important during the COVID-19 pandemic. And we were able to share lessons from the widening digital participation programme that we were funded by NHS England, NHS Digital to do up until 2020. But then beyond that, it's really been about recognising that the pace of digital change in health and in accessing health and in all aspects of our lives just keeps on growing. And actually, we need that attention on digital inclusion for health to grow alongside that. So we're members of the Health and Wellbeing Alliance. Proud members and proud to have done work with different policy leads in NHS England, but also using the intel and the information we have to learn from and learn with NHS and other health partners in other parts of the UK as well.
Fantastic. Welcome, Katie. Welcome, Emma. Thank you both so much for being with us. So as I said, I had a fantastic conversation with Minal Bakhai and with Sam Shah. So let's listen to the first snippet from that conversation. You love technology. So it's coming, is it? We just need some children and some animals now, don't we? And we'll have the whole tripartite of things you shouldn't be working with.
Yeah. So maybe whilst we're waiting for it to come, one of the things I mentioned there was NHS England's framework for action on digital inclusion, and that was launched just under a year ago. And it would be really interesting in the chat panel to see if you've heard of it, if you've read it, if you've used it. So that could be something that goes alongside.
Thank you, Emma. That's brilliant. Thanks, Rena.
Well, I think digital technology is an incredibly powerful enabler of health and healthcare access. And I think health is one of our most precious, well, it is our most precious asset. And it plays an absolutely critical role, both in our personal well-being, in economic growth, in our social connectedness, and in community development. And for me, I think we have this really important opportunity, particularly in primary care, because primary care is the front door to the NHS. So 93% of contacts with the NHS are with primary care. Primary care is deeply rooted in its communities. We have a really good understanding of our communities and really strong relationships. Almost everybody is registered with a general practice. So our reach is really incredible. And primary care, I would say, is one of the most innovative parts of the health system. So the combination of all of those elements means that if we can embed better digital access, digital enablers to improve health outcomes, and really focus on digital inclusion as part of healthcare, then I think the scale of the impact could be really incredible.
I mean, I think that's fantastic. And clearly there's a massive role for primary care. That's where the interface takes place. I think I'm going to take it upstream slightly more. I'm going to give you the public health dimension to this. I think digital places create fairer lives. So fairer digital places for fairer lives is where I sort of go with that. And the way I think of this is that we've got everything from digital itself as a way of tackling wider social determinants. So it makes people's lives healthier automatically through tackling some of those things. At the sort of strategic level, the data about individuals helps with better planning decisions and local authorities and health working together to work out where people's needs are. What do we tackle? What do we focus on? Where do we target these things? At the level of organizations and structures, really thinking about what is it that people might need in order to maybe access services, but the awareness of what might be wrong with them, what they can do to improve the way they live their lives, and not just the health component, but the other things that impact on health, whether it's access to education or any of those things. And then there's really the thing that's probably important to all of us, that piece where digitalization, digital itself, could help people improve their outcomes in their lives, focusing on how they optimize their health, how they do the best they can, whether it happens to be around everything from all the way down to taking medication to all the way to the other side and knowing how to manage certain conditions. So I think there's probably space in all of those things, but really the biggest piece is the early awareness and information about healthcare and reducing the information asymmetry that exists for the population.
Fantastic, fantastic. I think we could probably talk for an hour on just what they've just said in that clip there. It's fantastic. So, Katie, coming to you first. I think for Minal, obviously, as a policy lead and also a GP, she's obviously very pro primary care and how important it is. What do you think? Do you think primary care has a role in like assessing people's needs when it comes to digital exclusion?
I think like any service provider where we're relying on online services, digital services for communication and engagement, there is a need and a responsibility to understand people's digital confidence, skills, but also their preferences as well. We are going in a direction of travel where some essential services are 100% online. And sometimes that blunt implementation, well, often that blunt implementation is actually making people disengage. So I think it's really vital that, you know, it is the direction of travel that we're going. We can benefit from using online services, but we've really got to understand our local population when we're implementing that and make sure, for me, there's a big one about making sure it's a positive experience. I've had too many examples with the NHS app where, you know, people who are actually maybe not motivated in the first place to download the app are then having a really not a positive experience in registering. It's taking too long. You know, they're used to other apps where it's instant registration. And in some cases, I've had examples where it's been over a week before it's been validated. And that puts people off from using those services.
Absolutely, absolutely. Emma, I really love that phrase from Sam about fairer places for fairer lives, or fairer places create fairer lives, I think he might even have said. And we're going to talk later about that community-centred approach, of course, because that's very much where we are at Good Things. So what do you think about that public health lens, about not just looking at digital inclusion and health, the delivery of healthcare, if you like, but that wider public health lens? Oh, you're on mute, are you?
So I take it even wider than saying it's a public health lens. One of the things that Sam talked about there was about digital as a social determinant of health. Now, that's it's quite a jargony term, but what it means is that digital is not only important to be able to access online services, GP appointments, repeat prescriptions, NHS website, health information, but absolutely critically, it's also vital for all those different aspects of our lives that actually have a way bigger impact on our health, on our mental health, than health services itself. So I think that's at the heart of why the NHS talks about wider determinants, and it recognises education, housing, community participation, relationships, all of those things. And in fact, I was on a call earlier. I know Promising Trouble has done some new research, and they're calling digital a super social determinant because it really does affect all of those different areas. And what's great about their research is they've done two visualizations, one which maps how digital exclusion affects all of those areas of our lives, including but not only healthcare access, and one which shows how it supports and enables positively all of those areas of our lives as well. And so that's really where we're at in terms of, this is bigger than information asymmetry, as Sam mentioned. This really is about life and opportunity asymmetry. That is what we're seeing. And even when we're talking about, you were talking then, Katie, about the NHS app. So one of the things that I think is quite telling and worrying is that last year, we were at 30 million registered users of the NHS app. Now, being a registered user doesn't actually mean you use it regularly, frequently, etc. But nonetheless, that's actually, that was a real mile. So that's 33 million was the latest. The year before it was 30 million. And the year before that, it was around 22 million. So what we're already seeing, even with something that is so universal, as designed to be as accessible as possible.
Oops, we lost her.
Being registered on the NHS app. So I think we're, I just think that's it really speaks to the importance of change here. And of course, the outcome we want isn't everyone is registered on the NHS app. The outcome we want is everyone has the digital skills, confidence and support, which enables them to register and to use those other things that are probably going to affect their health even more.
Fantastic. And I'm really keen. So Digital Futures for Good, we very much devised this series about thinking about policy, but let's maybe leave that for towards the end. And also from what you're saying around that intersectionality about mission-led government rather than siloed department-led government. But anyway, we're going to pause both of those thoughts for now and go to our second video, because it's very much about how do we have the benefits of digitization and also make sure that we don't create the challenges of digital exclusion. So we'll go to the second video, hopefully a bit more smoothly than last time. Here we go.
And one of the things that we hear a lot from people within the Digital Inclusion Network is that people can't get GP appointments, as an example. So how do we square that circle? How do we make sure that we reap the benefits of digitisation, but we don't leave people behind? How do we make that happen?
So for me, I think it's about having a more inclusive model overall, and a key part of that, a key enabler of that is digital and digital access, but it's not the whole thing, it's the model. So we mustn't look at digital in isolation of the rest of the system and how we work our processes. So for example, you mentioned general practice. I'm a GP. I work in a really deprived area in northwest London. Most of my patients are working 0-hour contracts. low-income jobs, have significant caring responsibilities. And we typically, they have been, so where I work, there's a 10-year difference in mortality for my communities compared to some of the more affluent communities. Our prevalence of diabetes, cardiovascular disease, mental health, cancers, but particularly those cancers with the poorest outcomes, are much higher. So we need to make healthcare access really easy, and we need to improve the experience of access, because we know from all of the patient surveys, typically the population that have the poorest experience are also our most deprived populations. And so nationally, we are looking at a model of modern general practice. So it means that we move away from a first come, first served approach, fastest finger first, and a single one size fits all model, to one where you have more inclusive access. So you can access through going online, the telephone, in person. And what we see is that people use access routes dynamically. It's not that they're always online or they're always on the telephone. It change depending on their circumstance, the urgency of their need. So choice is really, really important, but it's also about parity of access routes. So each of those contact channels is treated equally, and that they're all highly usable and highly accessible.
Let's take the whole digital issue, and particularly the digital divide. We've got those people that live in digital poverty. For them, they can't afford access to the internet, devices, modern technology. Their lives are such that they may not be able to get online at the time of things. Then we've got big healthcare organisations and health service departments that are planning for technology and digitalisation, but not, say, recognising those people that will be otherwise left behind. And I see this with hospitals sending letters to patients about digital appointments without recognising the needs that the GP's already picked up, that person has particular language needs or has other particular technology requirements that are not then conveyed by the hospital on the other side. That's no fault of the GPs, it's not a fault of the hospital clinicians, but it's a system, a service design issue. And those things I worry about, that they get forgotten in this. And so I love the aspect and the sort of concept of service design and trying to bring that into our work and using that as a way of solving this. But I worry that we've got deeper and deeper inequalities in digitization that are emerging. That divide may on the surface be narrowing, but we've got a group of people that are disproportionately affected by the lack of access. So even though we might design amazing digital services, complement them by existing physical services, the gap that emerges both for them and clinicians seems to be deepening, and those are the people I worry about, because they probably have the greatest healthcare needs, but our systems and services don't really seem to be designed around them and for them. And really, I want everyone in the health system, whether they're policymakers, clinicians, or otherwise, asking the question, where are the others? Because those others are the people who have those needs that we sometimes forget. And as our workforce moves towards virtual wards or remote monitoring, they might not be in those physical places where those people are presenting anymore. So I worry about that divide that gets created.
Fantastic. And actually, Katie, I want to come straight to you, because I guess this is the pointy end of probably what you're doing day in, day out. So, and they're the things that you're specifically looking at. How do you square that circle, and how do you make a service that works for people in South Yorkshire? Do you want to say a little bit about some of the work that you're doing and how you're squaring that circle?
Yeah, absolutely. So it started off with a digital inclusion programme in Doncaster that we've recently extended across the whole of South Yorkshire. And we're actually partnering with Citizens Advice. And a big reason we're doing that, I mentioned earlier that 37% of our population live in the 20% most deprived communities. And, they typically are the people that are not able to use technology, that they're not able to afford the internet. And it's really helpful for us to be having conversations with those individuals about their real life day-to-day issues, so that we have the appropriate flexible support available. And I think what I've tried to do in terms of building our programme, and certainly my own role, is education, and actually making sure that we are making people aware of the digital divide that Sam just referred to, and actually saying some of those stats out loud, people hear them and they have to then consider them in their implementation of digital services. And, the one that I often quote from Good Things Foundation is the 14.9 million who don't regularly engage, have those low levels of digital engagement. And that comes back to the fact that some people are just choosing not to interact in that way. It's not always about whether or not they don't have the skills or they don't have the access to the technology. So it's about being informed about our local population and then building our support around it. So for me, what was coming out of that last video was the education. So it's educating our public about that direction of travel that we're going in, but also educating, in my role, health and care partners who are moving increasingly online and thinking that actually, if you're going 100%, you've got to make sure you've got a really good service, and you've got to make sure that it's easy to use, it's intuitive, and that it's a good experience. And what if something goes wrong? Have you got a backup for those people? I am not advocating for 100% digital. I think we need to have choice. And I think to one of the points made earlier that actually, if you open up that digital stream for some people, it opens up telephone appointments, face-to-face appointments for others who are making a choice not to use that. So I think there's lots of things that we can do, but coming together and that understanding our local population and not trying to have, a one-size-fits-all answer is really important.
Yeah, absolutely. And I think it's lucky in health because you're never going to be 100% digital. If you break an arm, you'll need an X-ray. Actually, if someone's got deep intersecting issues, then a face-to-face conversation is probably going to be how the clinician is going to find out about that. So I think it's lucky that it's not going to be 100% digital. Yeah, Emma, you want to come in?
Yeah, I think at the very highest level, choice is still part of the NHS long-term plan. There is a commitment that other channels do need to stay open. I think the real challenge is how to afford keeping those other channels open, and also how you offer choice alongside also supporting digital inclusion. And Katie, going back to something you said earlier, and something that Minal was talking about, she is such an advocate for the most inclusive design to make it as easy as possible for people to be able to use it. So I think for me, maybe thinking about, more expectations on like health, when you're doing equality impact assessments for a new health service or for an existing health service, you ought to be really thinking about digital and digital uses of that. But at the moment, that isn't hard baked into how either local authorities or NHS Foundation trusts approach equality impact assessments. So that's just one example of how we need to really embed this thinking more centrally. But I think the other thing from a kind of more community experience point of view is that even if there is still choice, it does feel harder in some areas, and with some GP practices. There are some amazing GP practices out there, but others less good, others providing maybe less choice, or it is more about that digital first sort of approach. And I think what happens there is that people feel worried and anxious that options for face-to-face are being closed down or are still remaining closed. They're anxious about not being able to use the digital tools or getting something wrong. And maybe they're living alone. Maybe they don't have people who can support them with that. And also, when you talk about health, these are really personal things. So maybe even if you do have other people around you, you don't have a private space to be able to make that call. And that's assuming you can afford the data, as Sam was saying, and you can afford the device, etc. So I think there's something about recognizing that is the reality for an awful lot of individuals and households. And so we really need to better resource and support that kind of that infrastructure, that guidance that can really help make choice meaningful.
Absolutely. Katie, did you want to come back in, or shall we keep pushing?
I think just a really quick point is that what we sometimes see is just blunt implementation of online services, and that's where, you know, we can't do that. That's turning people away. You know, I have had we have a lot of lived experience come through to our monthly digital inclusion meetings where we hear what, you know, what they're experiencing. And there was an example of an individual who wasn't registered with a GP practice, who was turned away because it was a bit of a computer says no, you've got to use this online method, and that's not okay. And that comes back to, again, like I say, of interpreting policy and bluntly implementing it is not how we can move forward in this space. We've really got to be thinking about, is this a good experience? Is this a good service?
Yeah. And Katie, it fills me with optimism that people like yourself, you're the director of digital, you're not the director of digital inclusion, right? That you have got it embedded in, like Sarah Arif is saying in the chat panel, that digital inclusion shouldn't be a standalone project. Minal Bakhai is the policy lead for primary and social care transformation and a GP. So it's really about understanding the care and the work of the NHS, and that digital is part of that, and some people are excluded, and how do we make sure they're either included into, I mean, whether it's choice, I mean, choice is right, but also I think we at Good Things always believe that we should help people to use the digital services if they can, if they want to, if we can help them with things like affordability, because that way they will be getting a wider set of benefits than purely using a face-to-face channel. But, you know, I think all of us probably see our GP face-to-face and speak to them on the phone and make online appointments. Even the digitally included amongst us aren't just using one channel when we're using the NHS. So the next video is about that community-centred approach, which is absolutely fantastic. So let's play the next video. I'm sure it's coming. Anyway, so last time you asked a question about the framework in the chat panel, and you had some people who said they had and some who said they hadn't. So you might want to look at that. Thanks,
What's
Rena.
also really important is that digital is one social determinant of health. And, you know, the challenges that community was facing was challenges with digital access and inclusion, but also with education, with housing, with employment. And so we need to look at it as a whole, and we need that partnership working across all, you know, across the whole system. And I think we do have an opportunity with integrated care systems that starts to build the pathway to enable us to do that. And if I go back for a second to primary care, you know, primary care has been working very closely with the voluntary sector, the community sector, local authority for a really long time, because we're all deeply connected to those communities. But I think the challenges there are that it takes a lot of time. You need that distributive shared leadership. You need those brilliant connectors to build the relationships both between the partners and understanding how we all work, but also with those communities. We need to be creative about how we use our funding and resources, because there's probably not going to be a significant injection of new money, but what we start to see is shared business cases, pooling of resources, because there's a long-term strategy, as you described, and shared outcomes towards where we're headed. But I think also really importantly, there's shared learning, there's shared data, there's shared knowledge, all of which can start to galvanise some of those changes. And I know with the Good Things Foundation, and I've particularly worked closely with some of the digital health hubs, it's a really great example of that partnership working, of bringing health and digital close together, because they're inextricably linked.
And this whole piece about community, sometimes I worry that biggest, the most senior decision makers and the leaders may not necessarily understand communities. Only this morning I was reading a report about how people's shopping habits, especially in certain communities, has changed. They've gone back to physical face-to-face shopping as opposed to online. And that's maybe not about their digital literacy or even about digital poverty, but just about them people seeing each other and wanting to go to a physical place. And it kind of takes us back to the concept of how a hub could be useful, because what people may have thought of as the hub might be more than just a place where they gain some more skills or learn how to access service, but it's bringing people together. any other public health program, we go into communities, we try and empower communities to take ownership of something and give them a degree of control to solve a problem. Well, should this be any different? Should it really be the likes of integrated care systems doing this? Or should we be handing it over to communities? Because if I had any degree of confidence, it's probably not in integrated care systems in the NHS or otherwise. Who knows how many days they'll last for, because the rate and pace of change in health systems will probably be far greater than the changes in communities. So even though digitization is moving at a rate of knots, communities, especially those most affected, might not be.
Okay, great. So Emma, let's come to you first. I mean, I think the role of communities, just maybe let's talk about mission-led government here too, right? So about and it was quite prescient, really, that Sam was saying, how long will they last? It's like, here we are with a new government. But and actually, Katie, this is on your patch. I was listening to a podcast the other day, The Rest is Money podcast with Robert Peston, and they were talking to Alan Milburn, who did some work in Barnsley. 25% of the working age population in Barnsley are not working, and they are unable to work. And when they actually did the research, a lot of that was around health needs, but also they did want to work, but there wasn't any work that suited them around hours, flexibility, place of work, etc. And so you've got really poor communities where you've got, but also whose responsibility is that? Like, is it the DWP? Obviously currently, the old system was very much about that job centres are basically about penalising people for not looking for work. They're not there to actually help people to get for work. And I'll just do a plug for the great conversation we did in Digital Futures for Good with Andy Burnham. Andy Burnham was saying he wanted devolved power for the benefit system, so he could change that, which was fantastic. But then you've actually got the people are not working, but they would like to work. But so is it the employers, is it the business department who should get employers to create good work that suits those people? Or is it actually the NHS's role, because those people actually work may be a pathway out of poor health for those individuals? So actually that's where I'm hoping mission-led government is going to come in. But if you underpin that with communities, then communities can play such a powerful role. So Emma, obviously we've done a lot of work at Good Things Foundation with communities.
Yeah, and one of the things that Minal mentioned there was around digital health hubs. And one of the things that I find so interesting about both digital and NHS is these like jargon-full areas, right? So a digital health hub really is a way of saying it's a local trusted place and space where there are people there might be staff, they might be volunteers, but they have the confidence and capability to help other people use digital tools to access things that could be helpful for their health and well-being, and including accessing maybe the NHS app or the NHS website. Now, those places can be, they might already be doing work around health and well-being. They might be community centre, they might be a library, there might be a GP medical practice kind of co-location going on. So the nature and shape of those places and what their core work is can look quite different. But the key thing is they have the confidence and capability to respond to the needs when someone comes in and says, how can I do this in terms of using digital in relation to their health and well-being? So I just think that's really important, because then actually you come to that question of, well, who funds that, right? The services that are happening in those libraries, community centres, homelessness hostels, etc., those are saving the NHS money, they're saving DWP money, they're saving, employers' money. So how do we ensure that those community organisations and centres and places have the support and the resources? I think that's where I will do a plug for the National Digital Inclusion Network, because actually what we're providing through that is both a place for all of those different organisations to learn from each other, so that shared knowledge, shared learning point, but also to be able to kind of access tools that already exist around helping people to build their digital skills or use the NHS website, the National Data Bank, the Device Bank. So those are resources that can make it easier for local organisations to respond to that need. But fundamentally, there also needs to be real support in those community organisations. And I think that's where, for me, Sam's point and Minal's point comes together, because if ICSs can see that they have more of a role in supporting digital inclusion, in partnering with local authorities, in partnering with the local voluntary and community sector, in directing some of the funding to those organisations, then that's what you need for the communities to also be able to access what they need from the people they trust. So for me, that's what brings those together.
Fantastic. Katie Bowman's come in just quickly, or we can show the next video and then we can hold that thought for later.
I can hold the thought.
Okay, fantastic. Well, let's just go to the final video and then we can bring it all together, and then hopefully we'll still have some time for questions. If you've got questions, please put them in the chat panel. That would be amazing. So our final video, I ask all of the participants what's their 100-day plan as Prime Minister. So let's hear from Minal and from Sam.
What do you think we could do to really, I guess it's partly to do with when you're improving health outcomes, when you're curing people, I guess maybe let's take it to the, to what the NHS mostly does, then you're probably not thinking about whether or not they can afford the internet, but clearly that's going to have such a massive impact on their health outcomes. So how can we make that work better?
I think the first thing is probably to also take it just out of the mindset of just the NHS.
Yeah.
In that our focus around health often is around the NHS as one system. The NHS is, I guess, one part of an ecosystem, whether that's the non-health determinants or other parts of healthcare that might be provided in different ways. So that's kind of one part of it. The second part, though, is also translating the way policymakers think about planning for health. So even down to a needs assessment. Historically, we'd look at where people access services and which services they already access. Who has ever really looked at the digital needs of the population and worked out how many of them need access to data and make that part of a needs assessment? That might help us focus and target where we might want to either put health services or things that will support health services. That's kind of one other part of it. The other thing is changing our mindset, our lens. We think of things in health from quite often, perhaps from a healthcare lens. What about all the other assets in a community? The hubs, the schools, the nurseries, the supermarkets, the marketplaces that people get together. Shouldn't that become part of our wider set of health assets that we engage with? And so we just need to change mindset and culture. And if I was approaching it, be thinking about how to change those of strategic policymakers, politicians, councillors, and people who are responsible for those big decisions around healthcare. Those people at a community level who have the direct access and who can engage, and then moving the resource, rather than putting all the resource in so downstream that it can't really have that impact, taking a bit upstream and thinking about those hubs as being the receiving point where we can make a difference, and joining up with the likes of whether it's Virgin O2 or others around implementing some of these types of schemes.
Yeah, absolutely. I think that investment point's critical. So let's think about investment. Let's think about the future government, right? So I think we know what to do, right? We've got it sorted. So what would you like a future government to do? So obviously not the current one, a future one.
So I think for me, I would put health at the centre of all my policy, and the creation of health at the centre of policy. And this is multi-agency, as we've talked about, multi-sector, cross-government. And so we already have some really great work that's already happened. You've described loads of it, Helen. We've got an architecture, but I think for me it's about how do we accelerate some of that. So we've got, the data banks, the digital banks, we've got the skills, training, Learn My Way, that I know that you've championed so wonderfully. During the pandemic, we had our telecom and mobile phone companies with their sort of zero data policy. So if you were accessing, NHS services, you could do that without cost. Well, why can't we extend that to all public health services that are all critical for basic needs management? But what I would do is I would ask across every government department that health is a kind of key outcome and priority across all of their work. All policy initiatives need to demonstrate how they're improving health. And I think it's really important to bring the community voice back into this. So for me, I kind of look at this a bit like climate change. And we've got net zero, really ambitious, multi-year, long-term policy objective. And so could we do something similar around health, where we understand what is most important to our communities and to the public? We almost have an independent organisation that holds us to account for delivering progress against that. And we set ourselves some really ambitious targets around it. But using the current infrastructure to accelerate that.
Right. What do you think, Sam, the future government should do?
I think a few things. I think all politicians, especially the current ones, need to move away from thinking of sickness as being an individual's problem. Sickness, people do not choose to become sick. They are sick because of their life circumstances. In many people's cases, one of those life circumstances will be the degree of digital inclusivity, and the degree of digital poverty will be contributing to their sickness. So we've got to avoid this scapegoating people being sick, and also chastising health service personnel, practitioners, GPs as part of that. We've got to move away from that. So future government, the first thing they need to do is change the communication between society, clinicians, and politicians around the roles of clinicians, especially GPs, and the issue of sickness, and recognise that sickness is really a symptom of one of those things being digitization. So to address it, first thing, solve digital poverty. Tackle the fact that there are some people who cannot afford devices or get online, and create an incentive scheme to give them access and eradicate digital poverty. It could easily be done. There's a small number of people in defined places. They're easily identifiable. We should be tackling that thing first. The second thing is around the degree of digital inclusivity. Set a target over a 5-year period to actually increase the degree of digital inclusivity. Create a program around improving the digital skills and literacy of the entire population, but particularly those in the most deprived communities. And then creating awareness amongst system leaders and others in business, in the environment, in schools and education, around the downside of digital disengagement, digital exclusivity. What are the problems it causes? People know, and to ask about where are the others and those people who are affected.
Fantastic. So obviously when they were talking about the current government, they meant the last government, because it was filmed before the election. So Katie, you very helpfully put in the chat panel about what you're doing in South Yorkshire about growing your social infrastructure network. How do you think, so what do you think is good policy around healthcare and digital inclusion? I mean, and maybe you could talk as a person, as an individual, rather than in your day job, as it were.
Yeah, I mean, I agree with a lot of the points that Sam was making there. And for me, we need that clear action plan. The digital poverty one, that's something where we have a responsibility there, don't we? Like I was saying earlier about that direction of travel, we know we're going in that direction. And so we know there is a simple action we can do to remove what is a really considerable barrier. I think for me, something that Emma said earlier about baking this into everything we do is what I would like to see. It's not just about our health and care services, it's delivery of essential services across all of our life. And if we can bake that in, so we're making those assessments and we're working with those community groups to understand. I think one of the things that I've certainly learned in leading our digital inclusion program here is don't make any assumptions. Don't presume why somebody might not be able to use a service, and build that flexible support. And the Good Things Foundation, your manifesto, you've not asked me to do this plug, but it's all really sensible stuff. It's like you said in the interviews, Helen, we know what we need to do. We just need to push that out and do more of it.
Yeah, absolutely. And Emma, what about this poll about digital needs, and is part of that needs assessment, or I mean, you've said it already, but Minal said it as well, like make health core to all policy areas?
So I think that's really interesting. I think the thing that I don't think we're ready for yet in that is that I don't think there's a strong enough understanding about how health actually is affected by digital exclusion and digital inclusion. So I think we know it conceptually, we see it every day through lived experience, but actually we don't have statistics coming out from the NHS or from the Office for National Statistics or from government that are indicators of how digital exclusion is impacting on people's health chances, on their mortality, on core indicators that are used to assess health. So I think it's a great idea. I don't think we're ready for that yet. I think it's part of, Helen, you mentioned earlier about mission-led government. I really like that idea of mission-led government, but we're talking about the need for joining up across those missions and digital inclusion actually being fundamental to delivery of all missions, not only the ones that happen to be in the, the relevant ministerial portfolio. It's absolutely essential for the NHS. One of the biggest things that's going to enable the NHS to thrive is around reducing demand, and you only reduce demand if you support preventative services, it often in communities, and you improve people's quality of life. And so I just want to close on actually Minal and Good Things Foundation, our team. We've been doing some research around local authority perspectives on working in collaboration with health partners, which I think is relevant because actually change needs to happen at all levels. And one of the responses from one of the local authorities about why they do this was that we want to be preventative, so we want to do digital inclusion. And I just thought that kind of sums it up from a health perspective. If you want to invest in the quality of people's lives and in preventing, growing demand on the NHS and in a healthier, fairer society, then we have to have digital inclusion supported through that.
Yeah. Brilliant. So just there's a lot of richness in the chat panel. Sorry, did someone just say something?
Yeah, it's me. I can't put it in my chat. I've got learning disabilities.
Okay, Natasha, do you want to ask a question?
Yeah, I just wanted to say that I was in hospital in March this year. When I came out, and before that, I used to have, under my reasonable adjustments, because I've got autism and learning disabilities, I used to have all my appointment letters sent out to me because I also have carers, and I need the appointment letters to help the carers understand how to care for me properly, and to help because sometimes I have to meet them at Harrogate Hospital or wherever, and they have to know what department has gone on. And without me doing anything or saying anything, then it automatically went through Patients Knows Best, because I live in Harrogate, and then NHS app. Well, it's just a nightmare because I can't, even my carers can't open it. We can't get the right information that we need, and we do, and it's been we like it might say where it is, but then it doesn't say what department it's from. It's very extremely horrific, and I've tried so many times to ring up the hospital and tried to say that under my reasonable adjustments this is not suitable, but they won't change it back. So
Natasha, you're saying that the digital, that they've just switched it to digital without actually understanding what your needs are as a person.
But then on the other side, want to give you both sides. I also am under the pain management team, and they deal with Teams and Zoom. If they want to do a Teams or Zoom meeting, then that's fine. I don't mind that because they automatically send me the link. I don't leave the house. But you have to put down as well, make note that if someone's got autism or a learning disability, if you put everything on digital, because I've got chronic health conditions like fibromyalgia and hypermobility, and I've got problems in my tummy, it's easy to mask. So you might not see the true me, because at home you probably won't see the true me, and you might think I'm okay when really I'm not.
Yeah, thank you so much. That's so good to have your real life perspective there. Emma, did you want to come in? I saw you leaning.
Well, yes. No, and the truth is that your experience is the experience of a lot of other people around the country, but it also speaks to that question around, what is digital good for, what isn't it good for, even if you have the support and everything you need to be able to use it. I think it's Francis Brown has mentioned a few times in the chat panel as well about, there can be a big assumption that digital channels or digital services are always better, and actually that isn't most people's experience. I thought Minal's point about, even people who are digitally engaged might be dynamic in terms of how they use it. But one of the things that really struck me there with your story was about, and I think that was fantastic that you followed up and said, actually, there should be a reasonable adjustment here. Now, hearing that story really, really worries me, because we do know that people have reasonable, can request reasonable adjustments. There should be then their communication preferences should be respected. But it goes to the point around the gap and the lag between things like thinking about reasonable adjustments, thinking about equality impact assessments, and thinking about digital inclusion, because those levers were often put in place way before digital channels were open. So I kind of feel that we're playing catch up with that, and the result of that is that people are not getting the service or the experience that they deserve. Yeah.
It's about that personalization at scale, and I think Natasha, it's brilliant to have that shared, because you like doing Zoom, but you need to have your communications in print, and actually, with all of the wonderful technology and wonderful, brilliant people we have, that should be recorded somewhere where you can get that personalized service. But actually, obviously, when you're doing things at scale, sometimes those things fall between the gaps. So thanks so much for sharing. And a couple of other questions.
Just to say, I think the other thing that Natasha mentioned was about carers, and that also links to the reminders in the chat panel that actually it isn't only us when we're patients or seeking health or social care for ourselves, it's also carers, it's also staff, that we really need to support NHS and social care staff better to be able to develop those skills and confidence.
What I was going to say was a follow-up from that. When I've been to hospital appointments, we've had to highlight it with the doctor, and the carers actually said face-to-face with the top neurologist who I'm seeing, please can you make sure any future appointments are done or sent by paper, and please can you put it on the notes, because I found it extremely difficult to care for Natasha, because I hate hospital. I've had bad experiences, so I've got to have a lot of just get me inside, and it's not fair, because that then puts a lot on pressure on the carer as well.
Yeah, absolutely. And thank you. That's so helpful. Two questions I just want to put to you both. I'm going to come to you first, Katie. The first one was really about, should it be mandatory that if the public sector is digitizing services, that they should get it right, and it should be intuitive and easy to use and not create more barriers? And the second question was really about, are there any other international examples of good practice that you've come across? So Katie, start with you and then quickly go to Emma, and then I will need to sum up.
Yes, I think it should be mandatory. I think, again, we need to be understanding not only the needs but preferences. And I do think that communication preferences is really important, and we land that. It's really interesting. I actually got asked the exact same question this morning at the Citizens Advice AGM about whether or not we are learning from what others are doing abroad. And actually what I said was, I'll come back to you guys at Good Things Foundation to see what you know. Our programme has absolutely benefited from sharing good learning and best practice that's been happening in the UK. And so I actually think we should be looking elsewhere. But to date, we have very much been looking at what's been happening in the UK.
Yeah, fantastic. And there's lots of good examples. And actually, I think it proves the intersectionality point, because I recently was on a panel where there are lots of great international examples about financial inclusion and digital inclusion. So it just goes to show about intersectionality. Emma, any last words from yourself?
Yes. So when I've had conversations with people who are focused on digital inclusion and health in other countries, actually there is a real commonality around the challenges here, and there's also a commonality around the importance of local support and that community support, but also you've just got to have that good design. So it goes back to inclusive design, so that they're as easy to use, so that yes, that should be mandatory. And I know that there is guidance out there, but part of the challenge within health, and even more so within social care, is actually the nature of the infrastructure of our health and social care. It means you can have great guidance at the top, but it can be actually really quite difficult to enforce or enact or get those into play, especially where ultimately a GP practice is its own business. So I think that also really complicates the challenge for us within the UK. And that's different. It's harder, I think, within England than it is within Scotland and within Wales, for example. So that was one thing. And I can't remember Estonia. Fantastic. Someone mentioned Estonia. Estonia is always up there. But one of the things that Estonia interestingly did was both do a massive and over time, right? So we're talking about over, I believe it's over 2 decades that they were skilling up local populations as citizens, but also they invested in digital skills training for every public sector worker, right? So it is that, those two folds.
We really should do some international best practice and put it on our website. Thank you so much. Thank you. Whistle stop tour around digital inclusion and health. Thank you so much to Katie Dowson for coming along, and to Emma. Thank you to Sam and Minal for taking the time. So the full video and this episode will be on our Digital Futures for Good webpage on our website. The next episode it's about AI and digital inclusion. And actually, we mentioned healthcare in there. You won't be surprised to know. So we've recorded that with Nina Schick, who's a global expert on artificial intelligence. And that episode is coming on the 10th of September. So please do watch social media and watch our website to sign up for AI and digital inclusion. So thank you all so much. We will be following up with an email, and thank you. I think this has been one of the episodes where there's been so much interaction in the chat panel as well. So thank you to everybody who participated, and I could see lots of sharing of email addresses and things too. It's been a fantastic episode. Thank you again, Katie and Emma, and thank you to our strategic partners, Vodafone, Virgin Media, O2, Accenture, and Nominet for supporting Good Things Foundation. And this particular episode was recorded by Virgin Media O2. So huge thanks to them for all of their support for Digital Futures for Good. Thank you, everyone, for coming. Bye.